Welcome. This is Dr. Ralph Esposito with Diagnostic Solutions Laboratory. And now we go to the natural product and drug interactions. So these are the pharmacogenomics. And what you see here is that these are the top natural products that may be worthy of attention for the patient. This does not mean that the patient must take all of these, but the practitioner can then decide which one of these agents or which several of these agents would be indicated for this particular individual. So folic acid. Now, many of you may say, well, folic acid, why would I give them folic acid? Why would I not give them folate? Or why would I not give them 5-methyl tetrahydrofolate? And the reason is this is what's reported in the literature. You must understand that GenomicInsight and Opus23 Explorer is very much evidence-based on the literature and PubMed studies and genome-wide association studies that give us this data. Now, if we had more data on the difference between folate and 5-MTHF or even folic acid, then that information would be in here. So it's up to practitioner to say, I know folic acid might help, but perhaps it's important to actually look at other sources of folic acid that I, as a practitioner, right, because this is the art of medicine, that I, as the practitioner, know that this might be even more helpful. Or you can be very, very strict and say, you know what, the data says folic acid, I'm going to give them folic acid. But then again, we have 5-methyl tetrahydrofolate, which is not as supported, or it certainly is quite supported by the literature, but not as much as folic acid. But then you can make the argument and say, hey, I want to give them, the activated form of folate. And so we see that comparison here of pyridoxine. So, you can use P5P or you can use pyridoxine, but we know from the literature that pyridoxine is much more reported in PubMed and other literature journals compared to pyridoxal 5-phosphate. Again, all must be taken within the context of the patient and within the individual, and also the practitioner's personal style and what they like to use. And then we look at drug interactions. So these are the pharmacogenomics. And this is something that the patient can take with themselves and move forward with it with other practitioners. And it takes their SNP data, looks at their alleles, so what the patient has, looks at the risk, and tells you what might be the side effect from a particular medication. So let's take, for example, morphine. This individual has 2A alleles for this particular SNP. And the risk allele is an A, right? But that does not mean that it is a negative, because you can see it's green, so it provides some benefit. So what we see here is that this individual might have a better response to pain relief drugs, such as morphine. And we have 2 of those here, right? And that can tell you maybe we really don't need to give this patient as much morphine if they needed it in a hospital setting. Or we can look at other things like statins or sildenafil, where we can see with this statin, the person is heterozygous, the risk allele is a T, they're heterozygous for the T, they have one of the T alleles, not another. So perhaps they have a slightly better response to drug therapy from rosuvastatin. And this will allow you to further tailor what statin that might be better for the patient, or if they will respond to statins at all. And this is exactly what the patient may want to do. And this is part of precision medicine, because what we're trying to do is make this as precise and as exact as possible. Because if we just throw random agents or prescriptions or any other food therapy at a particular patient, we want to be very precise in what we're doing so we know where it is targeting. And this allows us to do that entirely. So that is the conclusion of the report wizard. Please keep in mind, you can go back to the Opus23 Explorer report wizard, which is here on the left-hand side, and then you can modify these things. And maybe the network maps are not that important for them, and you don't want to bombard them with too much data. Or maybe you don't want to show them the non-risk because that's confusing for them. So then you can run the wizard again, and you can see this is auto-curated for you. So this is a very quick and hopefully informative tutorial for you. And there's certainly a lot to learn from this program. And I think as you continue to use the program, you will learn a significant amount more about genomics, how to utilize this, and I hope in the future you'll be able to go to the curation editor and be a whiz in the curation editor on your own. Well, thank you so much for your time. And this is Dr. Ralph Esposito with Diagnostic Solutions Laboratory, and I hope this was very helpful for all of you. Thanks so much.